Our next speaker is new to UCLA, but has made a big impact since she's been here. Shelby Yaceczko is one of our dietitians. She is one of the only few advanced practice registered dietitian nutritionists in California. She's board certified in sports nutrition, transplant nutrition, and nutrition support, focuses her efforts on providing personalized nutritional therapy in the treatment of complex disease states, including nutrition for cancer, gastrointestinal surgeries, improving the general wellness of patients through diet and lifestyle. And she works with the UCLA Aggie Hirshberg Center for Pancreatic Diseases and leads a new program on nutrition for safer surgeries. Shelby, we're looking forward to your talk, Dietary Management Post-Diagnosis.
All right, hi everyone, and thank you, Dr. Tran. I know I'm a bit of a worrywart myself, so I appreciated a lot of your advice. It definitely resonates. So I'm going to open up and talk about nutrition management post-diagnosis, which I think is typically a hot topic and something that across the board every patient or individual, caretaker, family member, loved one wants to have a better idea of. So we're going to talk about what's known as the New American Plate, if any of you have heard of that. We'll touch base a bit on nutrition impact symptoms, which is what I do a lot of my work in and my care with individuals and caretakers. We're going to talk about exocrine pancreatic insufficiency, otherwise known as EPI, and I'll give you some tips and tricks in our screening tool that I use personally, and just nutrition for well-being. So how does nutrition impact our day-to-day and our well-being? I hope today can also open up your eyes to see both the importance of nutrition, but also really how you can take some of these things home and apply them to your own life as well as with your loved ones. So the New American Plate, has anyone heard of this? I'm curious. Go ahead and raise your hand if you have a couple of you. Awesome. So this is from the American Institute of Cancer Research, or AICR, and this is the kind of new plate that they've determined to be more of this anti-cancer plate, if you will. So really the focus of this plate, and I'll show you an example in just a moment, but two main P's, if you will, portion and proportion. So how much are we eating at intervals throughout our day? And during those intervals, what is that composition, or what is the proportion of those different types of foods that we're putting onto our plates? So the goal is to overload our plate with bigger portions of our produce, our vegetables, our fruits, as well as our whole grains or our more complex carbohydrates. And we actually want to potentially reduce down a bit of the animal proteins while focusing on some of the plant proteins as part of this new American Plate. So here's an example of what this might look like for context. So we have a third, again or less, coming from our animal proteins, and we have 2/3 or more coming from these really rich, colorful sources of fruits and vegetables. So what you'll notice on this plate is a couple different colors. So something I like to always give my patients homework. Everyone knows I always give homework to them. But I always ask, go home and I want you to look at for 1 week, what colors are you eating? Do you primarily eat from greens? Do you primarily eat from reds? And how can we get all the different colors of the rainbow onto your plate throughout the week? So that's kind of a really fun tip and trick that you can take home with you today as well. So my Nutrition for Pancreatic Cancer 12-point checklist looks like this. And while I'm working with different individuals, patients, and caretakers, these are different points that we'll take home and talk about. We usually don't get through all 12 in one session. You can imagine that would be quite the session. But I want we'll kind of go over this together and see what resonates with you and see what opportunities you may have to troubleshoot with, whether it be yourself or a loved one. So we want to monitor and maintain a healthy body weight. That weight may be different depending on where you're at in your journey. I like to really focus more on our muscles and our muscle mass as opposed to just a body weight number on the scale. So we're really dialing into both our healthy body weight and the composition of that particular body weight. So keeping those muscles strong and keeping those muscles on us really is key to an individual's health and well-being to stay strong. Staying hydrated. What does your hydration plan look like? How many of you in here have a hydration plan? So a lot of you don't, not something surprising. So really dialing in and seeing how can we come up with a hydration plan that's going to allow our body to stay hydrated throughout the day so we're not water guzzling, is like I call it, right before bedtime, and then waking up and urinating throughout the night and having disrupted sleep because of that. So we often like to play catch up later in the daytime to account for the time we may have lost without having that hydration plan set in stone. A really good rule of thumb is to break up your day into 3 sections. So think of how many hours you're awake, break it up into 3 sections, and divide how much hydration or fluids that you'd like to take in that day in between those 3 different sections so you can really space it out. I encourage you to even consider using things like a phone alarm just as a gentle reminder throughout the day to keep you on target. Eat small, frequent meals. Now, this doesn't make sense for everyone, depending on your lifestyle, your potential work schedule, what you've got going at home in your personal life. You may not be able to eat 6 small meals a day, and that is okay. So what can we do to make sure that we have the appropriate portion and proportion, those 2 P's again, to get in these nutrient-dense foods throughout the day to keep your body fueled, rather than doing one large meal, which may lead to some things like energy or mood swings or really not getting in the full nutrition that our body needs. High protein foods with every meal. So focusing back to how do we get in that good quality protein source on a third of that plate. Considering the use of additional liquid protein shakes, meals, or smoothies. So if we're not able to eat it, are we able to drink it as an alternative, which can often help reduce some of these nutrition impact symptoms or those feelings of a lot of satiety associated with diagnosis or anti-cancer treatments. We want to choose foods that are easy to digest. This is a huge one. So oftentimes I see caretakers or loved ones wanting to increase the amount of a lot of these cruciferous vegetables or some of these different types of foods that may be a little bit more difficult to break down from our pancreas. So I encourage you to really explore what foods may be a little bit easier to digest while also giving you a nutrient-dense diet. There's a way to do both. Choosing essential whole grain foods, so choosing these complex carbohydrates while limiting sweets and added sugars. I mentioned about the colorful foods and seeing kind of what does your typical week look like from a color respect, and how do we have room to increase the diet diversity or the different shades and hues that you typically consume. Including healthy fats. So fats are a great calorie source. No reason to particularly restrict them, but we want to include the types of fats that are going to be considered a little bit more anti-inflammatory versus something like a saturated fat that's known to be a bit more pro-inflammatory. And we'll touch base on that today as well. I want you to watch for changes in bowel habits, and I'm going to go through this in detail, so stay tuned on that one, as well as stay active. One question, without a doubt, you can't get through a consultation with me without me asking about your physical activity. I find that so very important from both a wellness, a meditation component for some people, as well as just movement for your body. So I like to ask, how do you enjoy moving your body? It doesn't have to be running a marathon. It doesn't have to be taking a structured 1-hour high-intensity workout class. But what does your body enjoy doing from a movement respect? So take a minute and reflect on that and see what that might look like. And if you don't know, try exploring it. See what you like to do to move your body around and what you can find enjoyment in. So malnutrition associated with pancreatic cancer is quite prevalent. These are some of the little bubbles, if you will, that can contribute to malnutrition with pancreatic cancer. So we have inflammation, which can be associated with the cancer itself, as well as our anti-cancer treatments, as well as certain foods that we're eating that may be considered more pro-inflammatory. We have altered metabolism, meaning that we may have difference as far as how much energy or protein we need to be consuming throughout our cancer care journey. Our oral intake, we often see patients are reducing how much they want to eat, and this can be due to things like anxiety, as Dr. Tran mentioned, or things like just not feeling very hungry, having altered cues, if you will, as far as hunger and satiety goes. Pancreatic insufficiency, this is a big one, so it gets its own box. Micronutrients, this goes along, especially with some of these other bubbles. So if we're not eating enough and we're not eating enough diet diversity, we can be at risk of having these different vitamin or mineral deficiencies, which can lead to symptoms and as well as a number of different conditions. So that's why having that balanced, nutrient-dense diet can be so important. If we're also not absorbing our food, we may be eating really well, but if we're not well absorbing that food, that can also put us at risk for both malnutrition or vitamin or mineral deficiencies. In motility, meaning how food is moving through your GI tract, can be altered, particularly during periods of treatment or after surgery. So these are all things that can contribute to malnutrition after a diagnosis. So this is what's known as exocrine pancreatic insufficiency, and I'm going to call it EPI moving forward so I don't have a big long term I have to keep repeating. But EPI is this condition caused by the inadequate delivery, synchrony, production, or activation or activity of pancreatic enzymes needed for normal digestion. So to break that down in a little bit of simpler terms, EPI is really when our pancreas may not be producing enough pancreatic enzymes to help us digest our food, or what is being produced isn't mixing quite right with the timing of the food itself. So we'll talk a little bit about pancreatic enzyme replacement therapy in a moment. But these three main pancreatic enzymes that the pancreas secretes is what's known as lipase, protease, and amylase. So if you are prescribed a prescription pancreatic enzyme replacement therapy as a medication to take with your meal times, those are those three enzymes that's in that medication, so you know. So a lot of times we think it's just for fat. It's really actually for carbohydrates, proteins, and fats, so all three of those. We do know that fats tend to be the macronutrient or that main kind of component nutrient that tends to have the most symptoms for people. So we tend to associate pancreatic insufficiency with fat malabsorption, but it does cover all three of those macronutrients. It's tough to diagnose EPI. To be honest, we don't have great markers in this, and I'll talk to you about that in a moment about what we do use. EPI, these different symptoms, which I'll show you, can be difficult because they overlap with a lot of other conditions. And it's often misdiagnosed in many people that we've seen going back to the literature. So here's some signs and symptoms, and I thought this emoji might be fun to help explain what I do in my role. So as part of our Canopy registered dietitian work group, since there's not a validated tool that's available, what we've adopted together with experts across the nation is this screening tool to help us appropriately capture individuals who may be experiencing exocrine pancreatic insufficiency throughout the continuum of their care. So on the left-hand side, you're going to see different symptoms, if you will, and on the right-hand side, that's kind of our stool talk that we'll go through. So we get pretty in-depth. I sometimes get people's eyes that pop out of their heads when we go through this because they're like, why are you asking me so much about my stools? But it is really important because it helps us give get a better idea of how you're both absorbing your nutrition as well as digesting and utilizing that nutrition. It can help us explain some of the things going on perhaps during your cancer journey. So on the left-hand side, I ask, are you experiencing excessive gas, things like belching or a lot of flatulence? Is that flatulence really foul? Do you notice that we've got some stinky stools? Do we have a lot of abdominal bloating, which is that internal pressure, versus abdominal distension, which is a girth measurement increase, meaning our belly's growing in size? Are we experiencing abdominal pain or cramping after eating? Do we have early satiety, or are we feeling really, really full with our meal times, which is unusual for you? Loss of appetite, or are we starting to avoid foods because of the symptoms we're experiencing? That's a huge one. If you're starting to completely change how you're eating because there's so many GI symptoms going, we have to question that and really see what's going on. Changes in bowel movements with meals, or weight loss despite eating normal amounts of foods. So if you feel like you're eating, you can't stop eating, and you're progressively losing weight, that is something that really I encourage you to talk with one of your healthcare providers to see, really, do we need to do a little bit more dive in to see if pancreatic insufficiency is on the table for you. Moving into the right-hand column with my little poop emoji. So this is looking at really the stools itself. So anyone who this applies to, please look in the toilet bowl. I know that sounds a little strange, but look in there, because that does help us understand what's going on from a digestion standpoint. So are your stools light tan, clay colored, or yellow in color? Is there an increased frequency of stools, especially after you eat, having that urgency to have a bowel movement? Are you having loose or unformed stools, liquid stools, fluffy or puffy stools, oily or greasy stools, or it looks like there's oil in that toilet bowl? Are stools starting to float up at the top and dispersing, as well as very large volume stools? So some testing considerations. So these are what we have available to us, as I mentioned. Again, it's not great in my opinion. Some of these don't have great reliability or sensitivity, meaning sometimes we get false positive reads, particularly our fecal elastase test at the top there, that's that FE1. So this is this kind of one-time stool sample that can help look for the amount of elastase in your stool to see if we are producing an adequate amount. Again, there are limitations to some of these, so we use them as part of the whole picture, the whole clinical picture when we're looking at pancreatic insufficiency. NCCN, which is the National Comprehensive Cancer Network Guidelines for 2021, published an update on pancreatic cancer care, and they noted in their guidelines that deficiency in pancreatic enzymes results in inadequate absorption of fat, carbohydrates, and proteins, as I mentioned, leading to steatorrhea, abdominal cramps, weight loss, and malnutrition. Because pancreatic exocrine insufficiency occurs in up to 94% of patients undergoing pancreatic surgery, therapy may be initiated without diagnostic tests. So what this kind of translates to is we need to be looking at if we need to be starting pancreatic enzyme replacement therapy more often than we previously thought in our patient population to make sure that malnutrition and insufficiency aren't going unnoticed. Nutrition is only one piece of the puzzle. I love nutrition. I'm sure you all can tell by now. But I also have a background in exercise physiology. That's where I did my graduate studies, and I used to work in the sport world. And the sport world is very unique. I wish it translated a little bit more to medicine, to be honest, that these care teams become very robust, and we're really focused on a lot of these mindful techniques. We're really preparing our athletes to be in the absolute best shape as possible. So as Dr. Hines mentioned, that's something I'm working on bringing to UCLA is how we can create safer surgeries and really get patients and anyone that this applies to who may be having an upcoming surgery in the best shape as possible. Because each component is only one piece of the puzzle, right? So I can work with you on your nutrition as much as I can to get you teed up. But there's so many other pieces that is important on your checklist to also consider throughout your cancer care journey. So sleep, there's a difference between the quality of sleep and the quantity of sleep. So if you're laying in bed for 10 hours, but realistically you're only sleeping for 4, that's a big gap that we want to look on filling. So what's keeping you up at night? Is it your GI symptoms? Is it your anxiety? Is it fear? So all of these things, working through and finding the right resources to help you troubleshoot is key. Daily movement and activity. So I'll ask you again, how do you move your body? How do you enjoy moving your body? If somebody tells you to go run for an hour, I would roll over on the ground because I don't like running anymore. I used to. I don't know why. But that's not something that strikes my fancy at this point. So find what you enjoy doing and what your body enjoys doing in the moment. Stress. Dr. Tran hit this one really nicely home, so I won't cover this piece. Also relationships and friendships. So nutrition can be something that gets in the way sometimes of a positive relationship or a friendship. So nutrition can be something where a loved one or a caretaker wants to really take that on and help support, but sometimes that can lead to friction. So that sometimes we may need to have a third party or somebody touch base to see how we can get everyone on the same page, despite the intention being really good. Quality of life. So I want to ask you all, what's important to you, right? I can tell you all the guidelines. I can tell you the best evidence. I can tell you what I know from my 8 years working in pancreatic cancer care. But what's important to you is really what matters. You're, as Dr. Tran said, the captain of your own ship, or you're the driver in your own car. So dialing that back and seeing what are your personal goals and what matters to you is really what's key. And that's what needs to be at the top of the list when the multidisciplinary team is discussing your care. NCCN guidelines, bringing this one back for patients with pancreatic cancer 2021. Because pain and malnutrition are also prevalent in patients with pancreatic cancer, the panel recommends that patients with locally advanced or metastatic pancreatic cancer receive a nutritional evaluation with a registered dietitian. So if this is something that applies to you and you haven't had that consultation with a registered dietitian, I encourage you to seek out that care and explore what that could look like to see if there's any opportunity to help improve your nutrition status as well as your quality of life. So some practical applications. Malnutrition as well as pancreatic insufficiency are very prevalent. So having that routine screening and having that screening done again and again and again to make sure that we're catching that if it's happening and being able to provide you with the most appropriate intervention and treatment is absolutely key. I cannot stress that one enough. So we need to be reassessing often in seeking care, getting those medical nutrition therapy services as NCCN recommends by a registered dietitian. This is a nice resource. So this just is a nice snapshot of the Hirshberg Foundation as far as their nutrition page. And I'm excited to announce we'll be doing a little bit more collaboration moving forward. I had some great conversations this morning to see how we can continue bringing the best resources possible and providing some interactive opportunities for you all in the future. This is my contact information if anyone would like to reach out. Again, my name is Shelby Yaceczko, and I'll open it up to any questions or any dialogue you all would like to have.
Shelby, thank you so much. We already have questions. First question is, can lactose intolerance result after a Whipple?
It can. The research shows about up to 30-ish%, give or take, looking at the literature. That's not to mean that you'll never be able to have a lactose food again. There's different amounts of lactose in food. We tend to see the liquid milks and some of the more dense lactose foods or drinks, if you will, are the ones that are most least tolerated. However, certain things like cheeses and some yogurts contain a lot less amounts of lactose. So I do encourage you to kind of explore the amounts of lactose in foods before you remove all dairy or all lactose-containing foods.
Next question, on your EPI screening and poop slide, do you need to be experiencing all of the listed symptoms, some?
That's a great question. There's not a threshold. Again, this was developed by our registered dietitian expert group through our Canopy Cancer Collective network. And really what we're doing when we're screening is working through some of these things and associating them back to nutrition and meal times. So perhaps you're experiencing things like fullness or you're having loose stools, and that may be associated with an anti-cancer treatment such as a chemotherapy drug. And if those things are going away once treatment may be over or at the intervals in between, that may be less associated with pancreatic insufficiency and more associated with treatment. So that's why we really do explore this. This usually takes me about 20 minutes to thoroughly do in order to properly assess and figure out if this is more related to an insufficiency.
Next one is, can constipation induced by opioids and palliative care hide some of the EPI symptoms?
Absolutely, and that's why I ask, actually, that's my last question on my screening is, are you on pain medications and how often are you taking them? The literature does support this as well, that pancreatic insufficiency is often masked by opioid drugs. So that is a conversation. We tend to see patients who are on opioid drugs tend to experience constipation, however, may have a lot of the excessive gas, the bloating, the foul-smelling stools, the foul-smelling gas when they are passing. And those may be kind of our markers that pancreatic insufficiency is there, rather than something like a liquid stool or frequent stools because of the medication constipating an individual.
On your one of your earlier slides, you recommended eating healthy fats. Can you give us an idea of what that would be?
Yeah, so I like to think, so a good way to think about it is looking at some of our liquid or our softer fats, if you will. So liquid fats may include things like our olive oils, some of our olive oil-based dressings, so that's a great way to add healthy fats. Things like chia seeds, things like avocados, which is a bit softer in nature. So avocados considered a fat more so than a vegetable. Sometimes those can get mixed up. Things like smooth nut butters is a great addition that can be used to help as a calorie booster, as well as in things like smoothies or some of our liquid drinks, if you will. So those are all going to be more healthy fats compared to something like, let's say, a red meat, which has a really nice fatty component to it, which is going to be more of that solid fat or that more saturated fat, which is known to be more pro-inflammatory.
Thank you very much. My father also had the Whipple procedure, and he's made it through about a third of the recommended chemotherapy sessions after that procedure. He unfortunately had to slow those sessions down, though, because of a lot of weakness. We thought it was the chemo that was preventing him from eating, but it turns out we think now that he developed an eating disorder. He pretty much refuses to eat anything. And this week he had to have a feeding tube put into his stomach. So we ask him to eat. He makes commitments to eat, but when it comes time to eat, he says things have no taste, or they taste, or they're very dry, and he gets no enjoyment from the sensation of eating anymore. And this is someone who used to weigh almost 250 pounds. He loved eating. Yeah. So I guess my question is this. He says, you know, he'll eat. He needs assurances that eventually things will taste good again.
Yeah.
So my question is this. How long does it typically take for people to regain that, I guess, their taste buds or does he need to eat for that to come back, or will it just kind of eventually happen without the chemo? What does that look like for a lot of people?
That's a great question, and thank you for sharing your story as well. So it's different for each person, but I would kind of dial back and see if there's opportunities for how we're preparing those meals to offer things like spices, herbs, different flavors to help combat some of those taste changes. I'm happy to talk with you offline as well. I have a really nice kind of nutrition impact symptom guide that I like to use to help individuals work through some of those taste changes, like the metallic or the very bland, or if we're having sour taste, often with foods that aren't supposed to taste like that. That can create a lot of what we, not so much necessarily an eating disorder, but what we call disordered eating, or we have these kind of disordered patterns around food, oftentimes due to fear of food, or food fear is what I say. So that's not uncommon, but I encourage you to, check in with your healthcare team, see if a registered dietitian can be a part of that care team to see if you can troubleshoot and work together to overcome some of that. Food fear is very real, particularly an individual after surgery, and if, oftentimes if somebody eats something and it doesn't go well, that can lead to feelings of devastation that their favorite food item did not digest well or it did not taste the same way, and that can really resonate with somebody for a long time.
Thank you very much. I'd love to speak to you afterwards to the side, or we can figure something out.
Yeah.
Thank you.
Of course.
Yeah, thank you. I was just wondering, is it ever possible, or is there hope that you can kind of reverse EPI?
Yeah, so that's a great question. So it can be more transient that we see for some people, meaning that for a certain period of time while the pancreas is perhaps recovering, we may have higher amounts of pancreatic enzyme needs, and then we're able to kind of titrate off. What the Australian guidelines say, and this is really what we have because we don't have one specific in the US at this time, is to start pancreatic enzyme replacement therapy consistently for 6 months after a pancreatic resection, specifically the Whipple's procedure, and then see kind of what that looks like in 6 months and reevaluate. I do a lot of titration, so a lot of my visits we're working on dose titration, we're working on what makes sense for this individual based on body weight, based on their diet composition of what they're eating, as well as what their GI tract looks like and the function of that GI tract. While we know we may have a certain amount of the pancreas inside, that pancreas may not be working to the function or to the level that we'd like, so we may need to have supplemental enzymes for certain periods of time, whether that's short-term or potentially long-term or for life.
Okay, yeah, I was thinking because after years, I'm like 6 years and taking them all the time, but I always think, is there a possibility that you wouldn't have to? Is there a way, another question.
Yeah.
Is there a way to see how your pancreas, is there testing to see perhaps how much of it is actually functioning anymore? I've read things where people say all of a sudden it sort of shrunk and, was like no longer there.
Yeah. So the somewhat of the beauty of enzymes is it does allow for individuals to have a little bit more diet diversity without experiencing those symptoms. So we tend to see, especially somebody that may need enzymes for a long period who want to come off enzymes, that can be a little bit tricky depending on what your diet pattern looks like, because we may need to restrict down some of the foods that you may enjoy in order to do that, to not have symptoms or not be symptomatic, as well as can lead to things like vitamin and mineral deficiencies if the enzymes are helping you absorb those important components. It is, I have found not everyone needs enzymes, and it does depend on where their journey is, but I would say have a consultation to kind of walk through and see what options may exist for you too.
Okay, thank you very much.
Of course.
Okay.
I have just a quick question about the test. You mentioned how they're low reliability sometimes, and you can get a lot of false positives from them. Mm-hmm. And sometimes, especially if your symptoms are being masked by other medications that you're taking, what other tests are available to kind of ensure a little bit more reliability?
Yeah, so the most widely used test kind of day-to-day in practice is that fecal elastase, which is that one-time stool sample. Depending on the literature that you look at, it's between 60 and 70% sensitive and reliable. However, we want to make sure we're not having fully liquid stools that are diluted. So an individual that's coming and having a stool sample and it's completely liquid, that tends to be a concern that it may not be a reliable test result. And again, going back to the NCCN guidelines, oftentimes we'll do something like an enzyme trial, meaning we'll start an enzyme for 2 to 4 weeks, work on titration and see if symptoms resolve. And if symptoms resolve for an individual, then that's a pretty helpful sign to show that perhaps this is pancreatic insufficiency that we're now treating because those symptoms have subsided for somebody.
Thank you.
Of course.
Can you just talk about financial toxicity from pancreatic enzymes?
Sure.
Many of our patients really cannot afford these. Is there a central place for help for them? Because it's recommended, but recommending something that costs hundreds of dollars a month isn't that helpful to our patients.
I hear you. So oftentimes individuals will come to me and they've been prescribed pancreatic enzymes and they tell me it's $700, I can't afford them. And I say, well, have you looked into some of the patient assistance programs or has somebody talked to you about that? So often that can be missed sometimes in translation, that there are patient assistance programs with the different companies who prescribe enzymes. And I cannot tell you how many times I've had a patient come back to me and say, it's now $5 since I've enrolled versus $700. So if you're getting a bill that's much higher and it sounds a little off-putting, please touch base with whether it be a registered dietitian or a social worker or a case manager or your oncologist to see what potential options you may have, because these are not meant to break your bank. These are meant to support your journey when you need them. Thank you, Dr. Heck. That's a great question.
This is our final question.
Sorry.
Hi, thank you. Great presentation. And the little poop thing is really great too. That's the first thing my nurse asks me when I come into the office is what it looks like. So I really could resonate with that. My question though is like when you're given the enzymes, the doctor pretty much just gives you the prescription, says take this. Mm-hmm. There's really how do you know how much you're supposed to be taking? Yeah. How do you take it? Do you take it after everything you eat, before meals? It's a lot of confusion for myself and a lot of other patients as well.
Yeah, thank you so much for bringing that up as well. So I'll do an enzyme education teach. This usually takes about 10 minutes, and it's that we should be taking enzymes within the first 5 minutes of our meal times, with all meals, all snacks that have more than a couple bites, if you will. I oftentimes see individuals are taking it in between meals, they're taking them with water, and we need them with our food. We need them with mixed meals that have that protein, fat, carbohydrate composition. And when you're prescribed enzymes, that's really meant to be a starter dose. If you go back to the literature, it's mind-blowing to me what is shown is how often patients are underdosed, and the dosing is never titrated on them. So that's something I'm a huge advocate of making sure individuals are on the right enzyme dose and they know how to titrate them. Because what your dose may be a year ago may not be what you need today, because your diet may have changed or your body weight may have changed or how your pancreas is functioning may has changed. So all those things go into conversation of what is your appropriate dose, and it may be different meal to meal. So it's not necessarily that you have this dose 3 times a day, and if you're eating 6 times a day, then having that prescription 3 times a day doesn't really make sense. So we have to put all those pieces together.
Yeah, thank you. And I know a lot of times they tell me that by the time they get done taking all the enzymes with all the water and everything, then they're too full to eat. So just trying to figure that out. So
Absolutely.
Thank you. I appreciate it.
Of course.
I just want to add one comment. Just like insulin, the enzymes giving with your meal to digest your meal. This is different from all other medications. You take it 3 times a day. No, this have to be paired and coupled with the food. If you're not eating, and there's no point to taking them. If you today eating more for special occasions, you may need to titrate it up. So that's something very important to remember. And that is for the food. Package with your food.
Thank you, Dr. Lee. Yeah, so making sure we're using enzymes appropriately. If you're concerned about your dose, don't do it on your own. Work with your healthcare team to make sure that we understand what's going to make sense for your body in order to combat and help support some of these EPI symptoms or nutrition impact symptoms you may experience.
Thank you so much.